better shake him. Like, you gotta shake him hard to get him up. And I'm thinking in my head, girl, build. I want to push now. Like, get this baby out of me now.
Pick up your phone, I need your attention. My girl so bad, we call her detention. I am so glad we moved beyond friendship. I am so glad your mama like me. Sweat up with Cupid, told her fight me. I stole your love, he shot my heart. I'm losing breath, it's getting...
Hi guys, welcome back to my channel. I am Bailey Newman and this is my YouTube channel. Here you will find mommy related videos, lifestyle related videos, and a little bit of about military life. I am currently a military wife. My husband is in the Army. I was prior service in the Army as well, and then we welcomed our baby girl into the world. But today's video is going to be about my labor and delivery experience with having my first baby and how it was. So let's go ahead and get into this tea. Okay, so I'm first going to start with, I had high blood pressure my whole entire pregnancy. It wasn't high enough to be classified as preeclampsia. I think they called it hypertension or something, chronic hypertension or something like that. It was classified as chronic hypertension. The induction date that we picked was December 12th. My last appointment was about 2 days prior to that date that we picked. Because I was about 39 weeks pregnant at that time, and I just wanted to get little Miss Myla, that is the name of my baby girl. I wanted to get her out of me, basically. So we chose the closest date for the induction date. December 12th comes around. My husband still had to work the beginning part of the day. I end up going into the hospital at 4 p.m. to get the induction process started. I was already super anxious because my doctor had told me if my blood pressure was super high when I got there, then my whole labor plan would be different. She didn't tell me exactly what because she didn't want me to get even more anxious. She told me enough, I feel, because I think if I would have known everything, it probably wouldn't have went the way that it did. So I get to the hospital, it's 4 p.m. I could barely even eat because I was so nervous. So we walked into the hospital and they take my blood pressure, and my blood pressure is 160 over something. The lower number wasn't in the hundreds, I know that. The top number was, but that is super high. So immediately they put me on magnesium. Magnesium is a drug that they put you on to prevent seizures, but it makes you feel like crap. It makes your whole labor experience totally different. I was planning on getting up, walking around, moving, squats, birth tub, the whole nine. Like that was the birth plan that I had in mind, and that's just not what happened. So when you get on magnesium, you have to have a catheter in. So once you get the catheter in, you can't be up and moving because you have the catheter in. So that's how my labor experience started, and it was terrible. I was trying to stay calm just for, you know, the baby Myla inside of me. Even though the whole time throughout my whole labor experience, she was completely fine, totally fine, heartbeat never decelerated, none of that. So after I get the magnesium in the catheter, they go ahead and insert the Cervidil, which is, it looks like a little like pill thing, and they put it next to your, or close to your cervix, so that it helps you to dilate. And I was already 1 centimeter dilated when I got there and 50% effaced. So they put the Cervidil in, and the Cervidil has to be in for 12 hours. And that's just how they kickstart your labor. I can't remember specifically if I was on Pitocin yet or not. I don't think I was. So they let me on the Cervidil for 12 hours. That whole 12 hours, I got 2 or 3 centimeters. I was stuck at 2 or 3 for a couple of hours. They took the Cervidil out, and then before they tried something else, they had asked me about, I kept on asking about the epidural, because walking in there, I knew that I wanted to get the epidural. If I was able to get up and walk and move, I probably would have waited a little bit longer, but I was already having contractions and they weren't as bad, I don't think, as they could have gotten. Obviously, you know, when you go natural, you feel literally everything. So I kept on asking about the epidural once they took the Cervidil out, and I ended up waiting, I think it was about an hour or two. And in between all of this time, they kept on having to come in and take my blood to make sure that I didn't have protein in my urine, because that's what preeclampsia is. And so they were taking my blood like about every hour, so I couldn't sleep or nothing. So they ended up deciding that I needed to get a PICC line, and if anyone is watching that knows me, I do not do well with hospitals. I don't like them. I do not go unless I absolutely positively have to, okay? And so the PICC line is where they put it like over here in my arm, and it's like a little, I think it's like, I don't know the medical terms for it, but it's like a little cord or needle or something, and it connects to like your heart, your artery or something like that. Listen, I and my husband couldn't be there for the PICC line insertion. It was just my nurse, and she couldn't even be like right there with me. So imagine going through all this. It's your first baby and you're going through all of this extra stuff. So I get the PICC line in, we go back in my room, and I'm like, the contractions start to get real. So I asked them for the epidural, and because I was so anxious and just so like overly aware, when the anesthesiologist came in and just talked to me about the epidural and my options and things like that, and he had told me that when you get the epidural, sometimes it can lower your blood pressure. So in my head, I'm like, okay, my body has been used to having high blood pressure my whole entire pregnancy. That's just what it's used to. So I kept on asking my nurse, what are we gonna do if my blood pressure drops? What are we gonna do if my blood pressure drops? And I knew that when your blood pressure drops, like, that's really bad. Like, you can die. And so I was super nervous, but I ended up getting the epidural, and it dropped my blood pressure significantly. It went from 160 over something to 80 over something. So imagine your body going from super high to super low. I just remember turning over to my nurse because I only had enough energy to turn my head, and I just remember telling her I don't feel good. And I'm pretty sure my face probably showed, because she had asked me like, how am I doing? And she was charting on the computer, and I say, I don't feel good, like something just doesn't feel right. So she checked my blood pressure, and that's when she realized that my blood pressure had dropped significantly. So they called the anesthesiologist back to my room, and there's like bolus, I think they called it bolus. They had to give me 10 of those in order to get my blood pressure back to stable. Throughout all of this, Myla's heart rate was not decelerating or anything. She was completely fine in there, moved around. Obviously, she would stop moving like when I was contracting, but she was completely fine during this whole entire time, which is super amazing to me, because I literally felt like it was the end, basically. Like, I was so scared, and my husband had literally just walked out the room to go and get me ice, and then this happens. So it's just amazing to me how I was going through so much, and Myla was in there completely fine, no heart decelerations or anything. Our bodies when we're pregnant is just the most amazing thing ever. Okay, so they had come and fixed my blood pressure. My blood pressure was back to being okay and good. When I tell you guys I was a G this whole time, I did not cry when they did the PICC line, when they told me about the magnesium and seizures. That freaked me out. Didn't cry during contractions, none of that. You want to know when I cried? The doctor came in and told me the procedure for C-sections. I was boo-hoo crying. When I say boo-hoo crying, and I was trying not to cry because she was telling me about it, and I'm like sitting there like, oh my goodness, you know, freaking out. And then you know how somebody, when you're about to cry and somebody's like, are you okay? Then waterworks, that was me. She said, okay, do you understand? I said, yeah. Tears, bawling. When I tell you bawling, she was like, no, it's okay, it's okay. We're gonna do the best we can about making sure that you have a vaginal delivery. This is just in case you and the baby are in severe danger, which I already knew, but just having a surgeon like come in and tell me, not a surgeon, you know what I'm saying, and come in and like actually talk to me about it, I was beside myself. at that point. But I got myself together and my husband helped me calm down. And then they both left and my nurse turned off the light because I could finally take a nap. Or she said, you know, take a nap because I think you're gonna go into labor pretty soon. Mind you, I was already in labor for about 24. I was in labor for a total of 36 hours, which is a really long time. So I start taking my nap. The nap was good. Then all of a sudden I wake up and I feel, when I tell you the most pressure I've ever felt in my whole entire life, I couldn't even place what it felt like. Like, I can place if it felt like the pain that I was feeling from a contraction, or like pressure, like I had to poop. And so I called the nurse in there. I'm like, I feel pressure, like I feel pressure really, really bad. And it was obviously because it was time for me to push. But she checked me and I was at a 10, but she was like, let it keep building. And I'm thinking in my head, girl, build. I want to push now. Like, get this baby out of me now. So she left the room again, and my husband is still, when I tell you guys, he is KO'd. He is knocked on the couch. I threw my pillow, extra sheets. I threw everything that I had in my reach that I could throw at him on the couch. I yelled extra loud to get him to wake up. Everything that you could possibly do without being able to get out of your bed, I did. This man did not wake up until the nurse came in and she was like, yeah, I heard you screaming, telling him to get up. Not like ah screaming, but like I was yelling his name, like get up, like I'm in pain, get up. And he's a heavy sleeper, like a deep sleeper anyways, but not having sleep on top of that just made him sleep even harder. So the nurse comes in and I'm like, can you wake him up? And at this point I have an attitude because I didn't realize that when you get that epidural, you still feel the pressure, and the pressure is very, 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 very uncomfortable. And the epidural obviously doesn't take away the pressure pain. Like, you need to feel that in order to push. So she goes over to him and she's like, hey Newman, can you wake up? Cody, wake up. Like shaking him like this. I'm like, you better shake him. Like, you gotta shake him hard to get him up. He wakes up, how you doing, babe? I was like, I want to kill you right now. What do you mean, how you doing? I'm in the most pain again and just uncomfortable, and I want her out of me. That's how I'm doing. And so he comes over and he calls like his mom. He calls my mom and tells him, I'm about to push. So while you do the practice pushes, it's only you and the nurse in there while you're just practicing how to push. If it's your first baby, they teach you how to push. So when I started pushing, I'm like, am I doing anything? Is anything happening? Like, what is going on? I'm not feeling anything. Am I pushing? Like, because she kept on saying, don't push like out of your butt, like push with your abs. And I just couldn't understand the concept of pushing with your abs. Like, I was like, what do you mean push with your abs? I'm confused. Like, I don't understand. And then the more practice pushes that we did, and we did that for about 30 minutes, and it was mainly because my contractions at that time, there weren't strong ones on top of each other at that time, like strong enough to where it would actually do something and move Myla down the birth canal. So once I actually start pushing, like close to the end of the practice pushes, it had to be like, it was like 2 times that I had practice pushes, and I pooped. I thought that I would be one of those people that was nervous about you pooping on the table. Girl, I was not worried about pooping on the table. I wanted this baby out of me, and that was it. That was all I was worried about. So I had pooped and I didn't even know, and my husband was like staring. When I tell you this man was staring down there, which I wasn't embarrassed about or nothing, but he was watching literally everything. When I say everything coming out, he was watching everything. So I had pooped and he looked at the nurse. He told me this after. He said, I looked at the nurse And I was like, can I tell her? And she was like, no, don't tell her. But I ended up not even caring anyways. So closer to the last 2 pushes of the practice pushes, her head was like right there. It was like crowning, and if I didn't have the epidural, it probably would have been the ring of fire. I think that's what they call it. But she was like, stop pushing, stop pushing. I'm like, what do you mean stop pushing? And then my husband's like, her head's right there, I can see it. And so the doctor comes in, she's like, hey, how you doing? You know, I think everyone thought that we were gonna be there pushing for hours, because they allow you to push for 3 hours before you have the baby. So the doctor comes in and she's like, okay, you ready? I'm like, yes, I'm ready, even though I'm like extremely tired, because it literally takes everything out of you. So I go to do the second to last, no, I had pushed 3 times after that. And so the main reason why that was is because the contractions weren't coming as strong as they needed to be. So I had like breaks in between, which I'm very grateful for, like closer to the beginning. So her head started to pop out, and then her head had popped out the whole way. And once her head came out, everything else just slid on out. And I had only pushed a total of 5 times, and I'd only been pushing for a total of 30 minutes. And my nurse was like, oh my goodness, you know, this is your first baby. You did it so quick. You did an amazing job. And the doctor's like, okay, Bailey, you tore. And at this point, Myla is laying on my chest. I will insert a picture, like a couple of pictures at the end of this video. But she is sitting, she's laying on my chest, and like me and my husband are just looking at each other. Like, I was crying. He teared up a tiny bit. We were just so happy and just so excited to finally meet her. And I could never explain what it feels like to hold your baby that you've been growing inside of you for 9 months. The feeling is indescribable. So I was just so excited, so happy. She was like saying, another thing that I was nervous about was stitches. And at the time, after giving birth, who cared? I did not care about nothing. Once she was on my chest, everything kind of just went away when it came to the pushing part, okay? So she stitched me up, and I had only tore like a little bit, and it was on this side of my vagina. So it wasn't like from your vagina, like the vagina hole into your butthole. It wasn't like that. So I was a little uncomfortable, but it wasn't bad. I was just so happy. Myla ended up being born at 4:10 a.m. on December 14th, 2 days before before my birthday, okay? We're both Sagittarius. My husband definitely has a lot on his hands, okay? But she was born at 4:10 in the morning. Her name is Myla Rose Newman. She is currently, right now, she is 5 months old. She just turned 5 months old a couple days ago now. And yeah, I'll just go ahead and tell you guys the aftercare, the aftermath, because when you are put on magnesium, you have to be on magnesium 24 hours before you give birth and 24 hours after you give birth. So I was stuck in the bed for 24 hours after I'd given birth. So my husband was doing all the diaper changes, all the diaper changes. He was getting up and handing her to me, things like that. And I just felt very blessed and grateful, but also sad because I couldn't be up and moving the way that I wanted to, because I still had the PICC line in my arm and the catheter in. So the last, I was in there a total of, I want to say 4 days. Yeah, I was in there a total of 4 days. I got my catheter taken out the day after she was born. So on the 15th, I'd gotten the medicine stopped and the catheter taken out. When I tell you I was happy, I was so happy. I'm just so grateful for all the nurses. If the labor and delivery nurses are watching this video, I just want to tell you guys, thank you, thank you, thank you. And keep up the good work, because I don't think I could have done it without the nurses that I had, with all the encouragement that they were giving me. So I had her, the aftercare was hard because I couldn't get up and shower. My nurses had to shower me and all that stuff because of the catheter and everything. And then I was bleeding a lot, because you know you bleed after a baby heavy. So it was just a lot going on, and it definitely changes your marriage for the better. Our marriage was good anyways before I got pregnant, but just I know him seeing me go through bringing our child in the world and just seeing how he catered to me and, you know, was worried about me and was just there for the support for me was amazing. He had to help the nurse was lifting my legs, and he like lifted me up to move me so that they could change the pad, and he was helping like clean me and all that stuff. So yeah, that was about it for my labor and delivery experience. I almost died, and I can look back on it and make light of it now, but in this situation obviously it was very, very, very scary. But I'm just grateful that my baby is completely fine. I'm completely fine. We're both healthy and doing amazing. So thank you guys so much for watching this video. Please like, comment, and subscribe, and hit that notification bell because I have a lot more exciting videos coming for you guys. Thanks again for all of your support, and I'll see you in the next one. Bye.
She likes chocolate covered strawberries and wine.